Type 2 diabetes is a chronic condition. It affects the way sugar is metabolized by your body. It is also known as adult-onset diabetes, but nowadays more children are being diagnosed with this disorder. The reason behind this could probably be the rise in childhood obesity. There is no permanent cure for type 2 diabetes. However, weight loss, eating clean, and working out can help manage the condition. If the condition is not manageable with just diet and exercise, then you may also require anti-diabetic medications or insulin therapy to manage your sugar levels. Let's have a brief peek at the below-mentioned early signs of type 2 diabetes. Keep watching to learn about them. Number 1. Perennial urination. When the levels of blood sugar in the human body are elevated, the kidneys tend to work harder to eliminate this surplus sugar by removing it. This tends to develop the urge to frequently urinate in a person. Number 2. Intensified thirst. The urge to frequently urinate to get rid of surplus sugar from the blood can lead to dehydration because of the additional loss of water from the body. This can lead to an individual feeling more thirsty than they normally would. Number 3. Increased feeling of hunger. People suffering from type 2 diabetes do not get an adequate supply of energy from what they consume. This is because in people with diabetes, the amount of glucose moving from the bloodstream into the body cells is not enough to produce energy. This is the reason why people having type 2 diabetes are always hungry, regardless of when they ate last. Number 4. Feeling fatigued. Type 2 diabetes has an impact on an individual's energy levels. People with type 2 diabetes tend to feel fatigued. This is due to the insufficient amount of glucose getting transported from the blood circulation into the body cells. Number 5. Blur eyesight. A surplus sugar amount in the bloodstream can cause damage to the small blood vessels that are present in the human eyes, which can lead to blur vision. This blurriness can happen in just one eye or the two of them, and it may also occur simultaneously. If an individual with diabetes stays without getting any medical treatment for the condition, then the harm to these tiny vessels may get severe and may lead to vision loss permanently. Number 6. Delayed healing of wounds. Abnormally elevated levels of glucose in the bloodstream can cause damage to the blood vessels and the nerves. This damage can lead to impaired blood circulation. This is the reason why even small wounds take longer to heal in people with type 2 diabetes. Number 7. Tingling sensation in the muscles. A high blood glucose level has an impact on the circulation of the blood, and it can damage nerves. In individuals suffering from type 2 diabetes, this may cause pain or a tingling sensation in the muscles of the palm and feet. An appropriate medical term for this is neuropathy, and if it doesn't get treated, then this can worsen over time, leading to more severe complications. Number 8. Dry skin patches. It is one of the very visible early signs of type 2 diabetes. This skin condition is called acanthosis nigricans. In this condition, dark skin patches form on the neck creases, armpits, or groin. Number 9. Yeast infections. An excess amount of glucose in the bloodstream along with frequent urination can become a food source for the yeast. This may cause a yeast infection. This condition tends to take place on warm and wet areas of the skin, for instance, the mouth, armpits, and genital areas.